Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome, listeners, to a spooky edition of The Health Advocates. I'm Stephen Newmar, Chief Policy Officer at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF. And that's right, today we're doing something a little bit different. We are diving into the eerie, the unsettling, and sometimes downright scary side of healthcare.
That's right, it's time for some healthcare spooky stories, because what's spookier than a haunted house? Getting stuck in a scary healthcare scenario.
100%, but also, don't worry, we're not here to scare you. We're here to just share real stories about what can go wrong in the healthcare world, and more importantly, how patients like you have spoken up and advocated for themselves and turned these scary situations into empowering outcomes.
Exactly. We all know that navigating the healthcare system can be a real fright sometimes, from misdiagnoses to medication mix-ups or even getting ghosted by your doctor. There are some truly hair-raising experiences out there. But today's stories aren't just about things going wrong, they're about how these patients found the courage to speak up and get the care they deserved.
So, Stephen, I spoke to 3 of our colleagues who live with different chronic illnesses about their spooky turned advocacy healthcare stories. I'm excited for you all to have a listen and maybe learn a trick or two about advocating. First up, we have Shelley. So imagine heading out for a nice dinner with your family, only to end the night in the emergency room. The care Shelley received was just confusing, chaotic, and awful. A true healthcare horror story. So let's dive into what happened and how Shelley had to navigate the confusion to get the right care. Hi, Shelley.
Hi, Zoe.
Welcome to our spooky episode of The Health Advocates. We're excited to have you here. And why don't you start by introducing yourself?
Hi, I'm Shelley Fritz. I have rheumatoid arthritis and fibromyalgia and osteoarthritis. And I am a patient advocate, and I'm happy to share I'm not really happy to share my spooky story. I wish I didn't have so many to choose from to share today. So it was April of 2017. It was actually Easter weekend. It was April 15th. And I remember this date, and I always will because it was a bad day. So in the months leading up to April, I had been feeling a little bit funky. I had been feeling like my breathing was just like a little bit shallow. I was working as a teacher, and I was working with elementary kids and always on the go.
Yeah.
And my mother had passed a few months prior, had passed in the fall. So I was kind of attributing some of the breathing issues to panic and just not dealing with that well. And I wasn't really sure, but I saw an ENT. And we were doing some tests to try to figure out what was wrong, and we really couldn't pinpoint it. So as we're thinking about more tests we're going to do, he had wanted to set me up for those. Now we're at Saturday, April 15th, and my family decided to go rent a boat and go fishing. So they all went out, and I stayed home. I wasn't feeling so well, so I was just kind of laying around, reading, and just taking it easy. But it wasn't getting worse. I was just kind of laying on one side, and I felt uncomfortable moving around, but I didn't really know what was wrong. I honestly thought maybe I had indigestion. And I laugh at that, but I do have that problem sometimes. And sometimes that's a mistake people make, to think they have indigestion and then they don't deal with their problems. So first lesson learned.
Well, sometimes also you're like, it must be the most simplest, obvious reason, right? I get why your head went to indigestion. Sometimes you're like, oh, it's the simple, obvious thing. Nothing major going on here.
Exactly. And it's so complicated when you have chronic illnesses, and especially when you have more than one. And then you're trying to attribute, what is the cause of this? Is it the medication I just started? Is it the medication I was last on? What is going on? So, these things are running through my head. But anyway, I started to feel better, so much better that night we decided to go out to dinner. So we went to the melting pot.
Oh, I love the melting pot. Yeah.
There's no way I'm going to miss this. So we went, and it was 45 minutes or so away from our house, but it's worth the drive, right?
It is.
So it was my husband and my son and I. So we went to dinner, and we're enjoying the meal. Everything's going great. And then I'm not feeling well. I'm starting to get that. Maybe it's indigestion again, but now it's starting to become more pain. And the pain is in my chest, and it's on my left side specifically, and it's starting to move into my shoulder blade. Now I'm getting a little worried that maybe something else is going on. So I hide my pain pretty well, but not this night. My husband said, we need to leave. Something's not right. And so I think we're going home, right? I'm like, oh yeah, we should probably go home and rest. So we pack up from the melting pot a little bit early. We don't even get to the chocolate. We leave.
Oh no.
I know, bummer.
I'm like, is that the spooky part of the story? We didn't get dessert.
Didn't get dessert, and that's it. So we started driving. And, when you're in extreme pain, I'll speak for myself. I don't always make the best decisions because I can't think straight. And so another thing, a lesson learned is have a plan of action with your family and, your emergency contacts for when you have an emergency, that potential emergency that could happen one day that you're not expecting. And so, we had talked about what hospitals do we go to? We've had some bad experiences at different ones, but we were very far away. And my thinking was really strange this day. I said, we have to get my son home so that he can, he's in high school. He has a lot of stuff to do. We got to get him home. He can't be with us far away at a hospital. We need to go to that community hospital close to our house, which I'm just going to say without naming it was not the best choice. So we pass the first exit to a great hospital. And my husband goes, okay, I'm turning off to this hospital. And I say, no, we're going to this one. And he disagrees, but I say, no, I'm adamant. I can barely speak, mind you. It took me forever to get me in the car. I could barely breathe now. Now I'm like crying and I'm panicking because I can barely breathe. I don't want to breathe because any type of breath was like excruciating in my chest. And it was just shooting up into my shoulder blade and I couldn't move. So I was like stiff as a board in the back seat crying. And then I'm just like, I just want to get someplace to stop the car. Just stop the car. I kept saying, just stop the car. And he's like, well, I can stop it at this hospital. I said, no, you got to go to the one close to our house. We're on this really bumpy road with potholes and I'm just feel like I'm going to die.
Oh my gosh.
I think maybe I'm having a heart attack. I really thought it was a heart attack. And spoiler alert, it wasn't a heart attack.
Spoiler alert, Shelley's still here with us.
Yeah, it was not. But it was something potentially fatal. But it was not a heart attack. So we get to the hospital and go in the emergency room. And anyway, they start running some tests. And one of the first tests they did was they checked to make sure I wasn't having a heart attack. And they assured me that that wasn't probably what was going on because my stats looked pretty good. So they ran blood work. The blood work came back with a really high D-dimer level. And if you don't know, a D-dimer level that's high can indicate the possibility of blood clots.
Oh my gosh.
So then I'm like, a blood clot. So the nurse says, we're just going to run some more tests. Your D-dimer level. I have no idea what this is at the time.
Yeah, I'm learning what that is now. I don't think that's something most people know until they're encountering it, unfortunately.
Right. It wasn't a possibility in my head because I just didn't think that would happen to me, right? So it comes back high. She says, we're going to send you back for some x-rays. And so they move me to the x-ray table, which is excruciating. But I did learn a great tip that I'll share from the x-ray technician. That's where I learned that if you're in a lot of pain and you cross your arms in front of you and then they pull you up, it doesn't pull on these muscles right here. So crossing your arms and having your caregiver or emergency technician pull you up is a lot more helpful. So we got the test done and came back. And then all of a sudden there were like 5 people from the hospital in our little area, in a little cubby area. And they say, don't move. You can't move her. She has bilateral pulmonary embolisms. You have blood clots in both lungs. So I just was, what is going on? And then I'm like, oh my God, I'm going to die. And I just started to panic. My husband was like asking a bunch of questions, what does this mean? They started to act weird. They're like, we're just going to move her upstairs and just, try to keep her still. And we don't want to move her too much. And I'm like, I can't move. What is going on? This is horrifying. So they moved me upstairs and they gave me morphine to try to stop the pain. And this is where advocacy really came in because I had a nurse who hadn't read my chart, or she didn't read it thoroughly anyway. She didn't know that I had the blood clots. She came in and she immediately didn't ask me about my pain level. She came in to take my stats and she pulled me up from a lying down position to a sitting position.
Oh my gosh.
Just grabbed me from the back and just yanked me up. And it's like, I think a scream came out. I don't know because I could barely even make noises because I couldn't breathe well and talk. And I was like, no, I just stopped her. I was like, no, you can't do that. She's like, I have to take your stats. And I looked at my husband. So it's important to have somebody with you, whether it's your neighbor, just somebody with you to advocate for you because I couldn't speak. I couldn't voice what I was trying to say, but he knew in my eyes, he's like, look, you can't move her right now. She's in so much pain and this morphine's not working for her. I said, morphine doesn't work for me. I know from a previous experience, I need something different. And so she thought I just wanted more medication. And so her response to me was, look, lady, we can't give you more morphine. I said, I don't want any more morphine. I don't want it.
Yeah.
I need something different. And so nurses changed shifts. And thank goodness when another nurse came in, I said, look, I need another drug classification than morphine. This doesn't work for me. And she listened to me and she went back and talked to the doctor. And it was hours later, but I finally got another medication, Dilaudid, and that helped me to be able to breathe. And they got me on a blood thinner. And, long story short, I'm here today and I'm doing well and I don't have any more issues with that. But I had to go on a treatment for it to help the blood clots dissipate. I made some bad decisions in the moment of crisis, and it's important to first have a plan and then tell your family, no matter what I say, stick to my plan. But also when you know that there's a medication that you're being given that doesn't work for you well, it's important to speak up and also to have somebody there with you who can advocate for you.
Yeah, wow. Thank you for sharing that story, Shelley. And that sounds so terrifying. And I think there's so many elements of your story that just show strength in like changing course of action when things were going wrong and realizing that you needed help and relying on those around you. And I'm just so happy that you got the care you need. You're okay. And hopefully something like that has not happened since.
No.
Good.
No, it's been really calm.
Yeah, that is definitely a spooky story.
Yeah, unfortunately it is.
Yeah.
Thanks for letting me share it though.
Yeah, thanks for coming on, and I'm excited for you to hear the rest of the stories as part of this episode.
I'm excited to hear them too.
That is definitely a spooky story. Lots of important lessons in Shelley's story, especially about making a plan with your family for emergencies. I'll add too that when choosing hospitals, something to pay attention to is your insurance coverage and what is in-network and with your plan.
That's a really good point. And next up, I spoke to Sarah. When Sarah went to her doctor looking for answers, instead of getting help, she was told something shocking. Let's have a listen to what happened. Hey, Sarah, welcome to the Health Advocates.
Thank you, Zoe. I'm really excited to be back for this spooky episode. Let's get into it.
Yeah, we're excited to have you. I know you've been on before, but it's been a minute, so why don't you introduce yourself to our listeners?
Well, thank you. Thank you again. I'm Sarah Shaw. I am the Associate Director of Diversity, Equity, and Inclusion at the Global Healthy Living Foundation, and I also happen to be a person living with migraine. I've been living with chronic migraine for almost 8 years now.
And you have a spooky story to tell us. I'm actually quite excited because I don't know what you're going to talk about, and we often chat on the side about all things spooky in our healthcare stories, so I'm locked in and ready to see which one you pick today.
There's so many to choose from, and Zoe, it's been fun and also validating to have on the side conversations about our chronic illness boo-boos through the years. My spooky story is with an old doctor of mine, and it really taught me about the strength of advocating for myself. So I had been seeing a doctor to help treat my chronic migraine for about, I think, 4 years. And it got to the point where my migraines had just been getting worse and worse, and the treatments that I was on weren't exactly working, or I wasn't responding to the medication the way that I should have been. And my doctor got to the point where I think she was really frustrated at that, but she took it out on me and actually called me a problem patient. And that was a really sad and kind of horror in my chapter of dealing with chronic migraine, because not only was I in severe pain, but now my doctor had basically given up on me and said that there was nothing else that she could do, but didn't say those words exactly.
Wait, so set the scene for us. Were you just sitting in the room at the doctor's office on the table and she just said that to you?
Yeah, I had come in for a follow-up appointment after trying a newer medication, and she was just going over how I've been feeling, how I was doing, and I kind of gave her the not good, not well. I've had X amount of migraine attacks and the pain is at this level. And you could just tell she was getting kind of flustered and frustrated and just kind of exasperated out, was just like, man, you're such a problem patient.
Oh my gosh.
That really took me off guard. And I was like, it made me feel like I was doing something wrong as a patient, not responding to the medications. And I had used my knowledge as a migraine advocate of knowing that there were other treatments out out there that we could try. And I brought that up to her even after that comment happened. And she was like, oh, well, we can't try those. We're just going to get denied by insurance. And at that point, I was like, okay, this doctor, is not going to be advocating on my behalf. I'm my best advocate. And so I went home. Well, I cried in the car first after that happened.
Sarah, we love a cry in the car. Like, I feel like we're always messaging, yeah, just cried about my healthcare here, just cried about my healthcare there.
Nothing like a good cry to kind of set the scene and like inspire. Like, I feel like after a good cry, I'm always more energized to like advocate on behalf of myself and like other patients. So I went home after my cry and I was just sitting there and I was like, you know what? I'm going to go find a better doctor. I'm going to find someone who is going to listen to my needs, who's not going to give up on me. And it took me a while to not internalize that problem patient comment that obviously sat with me for a while. And then I found a wonderful doctor who listens to me. We deal with those same insurance issues that the old doctor was hesitant to work with because, she was like, you're just going to get denied. And believe me and my doctor, I want to say every 4 months, we're dealing with some other step therapy or prior authorization issue with one of my migraine medications. But every step of the way, she has always reassured me that she's going to do whatever she can to make sure we find a treatment plan that works well for me. And, I recently just had another issue and she jumped right on it. And I think, I don't want to say the moral of the story, but really, I think back to what would have happened if I hadn't like spoken up or if I hadn't gone home and really thought about, I deserve better care. I deserve a healthcare team that's going to advocate on behalf of me and who I work well with. And now to this day, unfortunately, the insurance denials are still coming, but I know I have a great teammate in my healthcare team to advocate with me.
I'm so glad that you have an amazing doctor now. And yeah, I feel like I can relate to how scary it is in the moment to hear those words, especially with like the power imbalance of a doctor and patient. Like they're supposed to be the expert and like one who's knowledgeable and like you're in their hands for care. And while we know a lot as advocates and because of the work we do and just living with chronic illness, like you're never going to know as much as the doctor, right? So like if a doctor is sitting there telling you you're the problem, like part of you is going to want to believe that and like get really scared.
Yeah, exactly. And I think the language that I picked up from my current doctor, which everyone that I meet in the work that we do here at GHLF is, she's like, you didn't fail the medication, the treatment failed you. And I think that's a much better way to have a conversation with a patient when every body is literally different and everyone reacts differently to different treatments. And sometimes it just doesn't work out, but the onus should never be put on the patient as the problem. It should be, you know what, it didn't work out, but we're going to keep fighting to make sure we can get you to feeling more baseline.
And just to bring it full circle, when you saw your new doctor who's amazing now, what are the kind of things you said in that first appointment to speak up and change what had happened in the past?
Honestly, and I remember it was 2020. Yeah. So everything went to telehealth. And I was sitting in the living room in front of my computer, like sweating profusely, like so nervous about that first appointment because I told her exactly what happened. I said, this is what my last doctor said. And it made me feel like really uncomfortable. And I had that awkward conversation, which wasn't really awkward, of saying like, I want to work with a doctor that's going to be able to work with me so I don't ever fall into that situation again. And I remember once I said that, she was like, listen, I'm your cheerleader. We're going to be teammates. That situation will not happen. I wish for every patient to be able to have that conversation and that situation that happens if they do have bad situations happen, to find the correct providers in your healthcare team to advocate along with you.
That's so powerful and such good advice because you don't necessarily need to know the path forward of like what's next, but you can clearly articulate to your doctor like what you don't want to happen and what happened in the past that was wrong for you. So thanks, Sarah, for sharing your spooky story with us.
Thanks, Zoe, for having me on this spooky episode.
Yeah, Sarah, more than happy to have you on as always. Well, Stephen, that was another unsettling story.
Yeah, unfortunately, this happens so often that patient's pain gets dismissed and it can lead to many years in between onset of symptoms to diagnosis. That's why the work we do here is so important, to help spread awareness and give people the tools to advocate for themselves like Sarah did.
It really does happen all too often. And actually, maybe it's time for my spooky story. I can tell you about a time where things didn't go as planned for me. I was debating what story to tell you, and Sarah's story made me remember a time where I felt just like something wasn't right seeing a doctor. So are you ready to hear it?
Sure.
As you know, I live with arthritis and Crohn's, and my specialist was like, okay, it's time to see a dermatologist. It's really important that you get a skin check every year, just given your diseases and the medications you're on. So I was like, okay, that sounds easy enough. I made the appointment. I saw the dermatologist. She was really late in coming in, and the appointment took a while to actually get started. But, it wasn't the best experience, wasn't the worst. I just moved on. Everything was fine. I hadn't gone back in a little bit. My rheumatologist was like, it's really time to go back and get another skin check. You're supposed to do these annually. So I just thought, I'll give that doctor another chance. I'll go. So here's where things took a turn. I got to the office, and I had waited around 40 minutes, and I went to the front desk and said, hey, I've been waiting here a while. Any idea when the doctor is going to see me? And they were like, I could tell they were really frustrated. They were like, yeah, she does this all the time. It'll be soon. Another 10 minutes go by, and now I'm like, okay, it's been basically an hour. I need to say something,
Oh my gosh.
My time's important too.
An hour. Wow.
I know. So I go up, and they're like, okay, we'll get you in a room. And I don't know if you, our listeners, have ever done a skin check, but what happens is that you get completely undressed and you're just in a gown, because they look at every inch of your body to see if there's moles or, spots of concern. So they put me in a room, they get me in the gown. Another hour passes of me sitting there waiting for the doctor.
I would have stolen all the cotton balls at least.
I know. And, I was feeling so vulnerable because I'm just sitting in this little paper gown. I didn't want to pop my head out to say what's going on, because I'm I'm not dressed appropriately. So I'm like, what do I do? What do I do? I've already wasted 2 hours here. I'm not going to just leave.
Yeah.
So the doctor comes in and is like, hey, what's going on? Let's do a skin test. And I was like, really? You're 2 hours late. And she was like, what? I am? And I was like, yeah, you're not going to say anything? And she was completely taken aback that I said that. And then she just mumbled a little sorry. It wasn't anything that was meaningful. So I was like, I'm just going to sit here, get the test done. And I can only guess what was going through her head when she did what she did next, when trying to change things around in the appointment maybe. But so she looked at my chart, saw I have these other 2 autoimmune diseases, and she asked me what treatments I'm on, and I take 2 injections, and she starts to say, at your age, you shouldn't be on those. There's better treatments now, and is talking about a newer class of medications, JAK inhibitors, which are great options for patients. But I was just so frustrated because this isn't the doctor that treats these conditions. She knows nothing about my plan. I'm sitting here after 2 hours undressed, and she's just telling me what treatments I should or should not be taking.
Oh man.
Yeah, I mean, your reaction is how I felt in the moment, just oh man, I gotta get out of here. I feel so uncomfortable. And for the part where things turned around, there was a bit of time where I didn't see a dermatologist, and finally I got the courage to go see one again. And I did a lot of research, and what went into that research was looking at, often on doctors' pages, they'll say what interests the doctor. So, I was looking for someone that deals with patients with different chronic diseases. I was reading patient reviews to see if other people had similar situations to me. And I went to this dermatologist. I had a great experience. I even, similar to Sarah, when I got there, I said, I've had a bad experience in the past. This is what I'm here for. And she was really thorough and, explained things every step of the way. And my learning from that was just one, if things don't feel right, trust your gut. I think after that first appointment with the dermatologist, I should have, just because nothing's good or bad doesn't mean you should keep going. 2, just because one provider didn't treat you right doesn't mean they all are.
Right.
And then also, if you don't feel comfortable speaking up, that's a problem. And it's really important to find a doctor that will give you the space to speak up.
Yeah. Well, at least on a positive note, you learned some things, to say the least. And that's a good thing going forward. You learn from your experiences, right? As others have also spoken up about too.
Yeah.
Oh man, it's wild. I have a relative who goes to a primary care doctor, elderly, loves the primary care doctor. And she tells me she waits over an hour every time. And I'm like, how could you go back? She said, I love him.
Oh my gosh.
I love him. He's the best. When you get taken in, he spends a lot of time with you, and that's the deal. And you know that he does that with everybody else before you. And then when it's your turn, you get your time too. And I said, well, all right, if you know that going in and you're willing to accept that, I guess that's okay. I would never do that because I don't have that kind of patience, but everyone's different. But man, oh man, to have gone through that without any, I can't believe there was like barely an apology or something, some mumbling, but wild. So not cool.
Yeah, exactly. And the whole appointment was like lasted 5 minutes. So unlike your relative, it was like I didn't get the time back in any capacity.
Yeah.
To then be questioning what my other doctor's doing when she didn't even ask for my opinion. Like, I'm happy on my treatment.
Oh, man.
That really got me.
I'll tell you another really quick one. I know someone who went to a doctor, it was for something a little more substantive. I don't remember the full details, but it was like to inspect something with difficulty swallowing, and got to see a specialist. And you know how that can be sometimes, those super specialists, it's hard to get an appointment, or they have you waiting. And she was waiting almost 2 hours as well, and including 1 hour in the room. And she got to the point where she started to leave, and she said, I would like my file. And right away they were like, no, we're so sorry. No, the doctor's, and all of a sudden the doctor came right in. She said, no, I'm done. I don't want to be here anymore. I don't like the treatment. Been 2 hours and nobody's spoken to me, and I don't like that. That leaves me with a bad taste in my mouth. So anyway, very, very scary.
Yeah, I mean, just walking out, that's so powerful to say, you know, like my time's just as valuable. And like with the power, I was talking about this with Sarah, you know, there's such a power imbalance with you feel the doctor's this expert and has all these credentials and you should respect them. But like, no, you're the patient and you're there. Like you and your insurance are paying for this time. Like you really should get out of it what you need.
Yeah, it's a tough situation. I mean, part of it, I hate to say it like this, part of it is like you keep expectations low. Number one, I always bring reading materials with me. Something like, okay,
Yeah.
I'm stuck here, at least I have a book or work or my laptop or something. And also I do try my best to find doctors that will not keep me waiting, that are notorious for being good about keeping appointments on time. I also, oh gosh, I don't want to give away this secret, but whatever. I always choose the first appointment of the day whenever I can.
Oh, yeah, that's a good one. It's kind of like flights too. Like usually the ones in the morning take off on time, and as the day goes on, it's delayed.
Totally. Even if the doctor's stuck in traffic, you're still the first one in. So how late can it be? The other one, by the way, is the first one after lunch.
Oh, yeah, that's a good one too.
Yeah, if you could figure that out. Although I've had very dare I say, nasty receptionists who say, the doctor doesn't take lunch. She has no time for lunches. I'm like, yeah, I'm pretty sure she's eating something somewhere along the way. I can't imagine she's in here 9 hours, but whatever. And if that's the case, then that's really bad for the people coming late in the day.
Well, you know, lastly, we are heading into the MRI machine, which is never a fun place to be. When JP's scan didn't go as planned, she took charge and fought for the approval she needed. Let's hear how JP made it happen. Hey JP, welcome to our special spooky edition of the Health Advocates.
Hi Zoe, thank you for having me today.
Well, I'm excited to hear your spooky healthcare story, but before we dive in, why don't you introduce yourself to our listeners?
Sure, my name is JP Summers. I'm the Senior Patient Advocate Community Outreach Manager at the Global Healthy Living Foundation. I'm also someone who has several chronic conditions, and I'm a caregiver to my mom and my son who also have chronic conditions.
So yeah, what I'm hearing is you have a bunch of chronic conditions and you're a caregiver, so there must be a library of spooky stories you could have picked from.
Yes, definitely.
But let's hear the one you're going to share with us today.
So you're right, there are several stories, but the one out of all of the stories that I feel is the scariest and to this day haunts me, and when I say haunts me, it still gives me a phobia, is when I went in for MRI during the early stages of my chronic journey, which I didn't know I was going to get diagnosed with something. I was sent by an ENT specialist to get some scans, and I've had several MRIs before, so it was like nothing new to me. I'm like, oh, now piece of cake. Well, at that point, I was having 2 months straight of head pain, nausea, dizziness. I just was not well. So, and I also wasn't driving, so my mom had taken me to, again, just a regular MRI appointment. I went in, the radiologist just kind of familiarized myself with, okay, this is what we're going to do. And as I was laying down and he was getting ready to proceed with putting my arms in position and making sure that I was comfortable, I just felt uneasy. And as the machine started up, I started to sweat. And then my heart started racing, which is very unusual because, again, I've had these before. So I was just kind of laying there. And as the machine the part where you lay on was moving into the MRI machine, my whole body, like I started to shake. I started to just feel uneasy, like my skin was crawling. And I look back and I think, I don't know if it's because I was in pain or just simply because of the situation. Again, I wasn't getting any answers. I was just in this mental state that that wasn't well at all. And all of a sudden, I dug my hand or my fingers into my hands so hard that I left like fingernail marks. And I was like crying. And all of a sudden, the radiologist was like, "Are you okay?" And I was screaming. I'm like, "Get me out, get me out." Because I was halfway in. I'm like, "Get me out of here, get me out of here." And so he's like, "It's going to take like a minute at least to pull the." I'm like, and I was hyperventilating and I was sweating, crying, all these things. My body was just having this bad reaction. And so he got me out and I couldn't stop crying. I was shaking. He was trying to calm me down. Nothing was working. And he was like, "Is there anyone here with you?" And I'm like, "My mom, my mom, my mom." So he brought her in and I just remembered laying there just bawling. My heart was still racing. And she was like kind of patting my head, like, "It's going to be okay. It's going to be okay." And I'm like, "I can't do this. I can't do this. Like, I can't go into that MRI machine." And so after that, again, moment, he goes, "Do you have a history of panic attacks?" I'm like, no, I've never had one before. And he's like, "Well, it's safe to say you're having one." And so we were there for like at least 30 minutes before I could get off the table because I was still like just crying and shaking. And so my mom was, there next to me, just trying to calm me down, trying to like, "It's going to be okay." So in the process of that, the radiologist was like, "Give me a moment. I'm going to make some calls." He came back to me about 10 minutes later. And he's like, "Well, I don't know how you feel about trying to open MRI." He's like, "But there's going to be a process because your insurance company." And I'm like, "Oh, great. Another insurance obstacle." Because already at that point, I was going through several hurdles just trying to obtain care for myself. And so he's like, "Well, I'm going to type up a report to send to the ENT specialist and see if we can get one pre-authorized." And he's like, "You may have to talk to someone with the insurance company as well." And I'm like, "I don't care. I just can't do this. I can't go in through the MRI machine." So I did have to talk to someone. It was like the next day, the ENT specialist put in a request and the nurse did call me. She's like, "Okay, we put in a request. We don't know how long it's going to take. Chances are you're not going to get approved because this is not something they tend to do often. You kind of have to you might have to speak with them." And at that point, I hadn't even started advocating yet as a patient. So I said, "You know what, whatever I need to do," I said, "I cannot go through that MRI machine." So I did talk to the insurance company, and then with the notes the ENT specialist sent, I just said I had a panic attack. I want to figure out what's going on with my health. Like, something's not right. I can't walk unassisted. I've gone too much straight with head pain, nausea, dizziness, all these symptoms. And I'm like, I really do need to get this test up because we need to figure out what's going on with me. It took almost 3 weeks. I had to make 2 additional phone calls. So 3 phone calls total to the insurance company just to vouch for myself, saying I can't do a normal MRI. So it took 3 weeks to get approved for me to do an open MRI scan, which I will say this, I did have a little bit of phobia going in because I've never had an open MRI. It is a little bit different. It's not as open as they say, because I walked in there and I looked at it and I'm like, I thought open is like open, and it's like, no, you still go underneath it. So it's like the way I said, it looked like a huge hamburger bun. It's round and they put you in the middle of it, so you still have something like this over your face. Like, it's this close. Like, if you sneeze, you're gonna hit your head. Close.
Oh my gosh. Yeah, that doesn't sound open.
No, I had to convince myself this is to get answers. This is to get answers. You got to do this to get answers. And I had to coach like myself through it, like through the process of getting that open MRI. But at the same time, I thought, I cannot believe that I had to be on the phone several times just to get to this point. And that was something that early in my stages of getting diagnosis, I didn't realize that this was going to be something I was going to continuously do throughout my journey. But going forward, if I was ever to need an MRI, at least I now know the process. And that helps me to feel a little bit more comforted with knowing that I can fight for an open MRI if need be.
Yeah, I think you're talking about something so real that happens a lot with chronic illness that actually I'm really glad you're talking about because I don't see it talked about a lot, but a lot of the diagnostic tests are like really takes a toll on you. Like, for instance, I have Crohn's and I remember thinking how like doing the colonoscopy, you have to do a prep or sometimes even a scan, like what you're talking about, there was some weird liquid to drink with it. And it was so uncomfortable and people just made such light of it. Like, oh, it's easy, you just drink this and we'll get an image. And you're sitting there like so confused. Like, do I just have to endure this? Is this normal? Like a lot of the stuff you were talking about, like, I'm just trying to calm down. Like, why can't I do it? And it's it's like such a real fear. And I'm really glad you're talking about this because like the more I think about it, the more like a lot of people just don't talk about these like diagnostic tests you have to go through that are really challenging.
I agree. And being someone that's gone through several diagnostic testing, I will say that, yeah, there's that little bit of anxiety already going in because, for one, you're like thinking, okay, so now I'm going to get this test done, but am I going to be okay with getting the answers that they might have for me afterwards? But also
Yeah.
the prep going into it. And that's something, again, as someone who's dealt with several conditions getting diagnosed, the prep alone, it's like it's going to happen, but at the same time you kind of dread it because you're just like, oh, I'm going to have to do this, I can't eat. Fasting, that's something, again, that some of us with certain conditions,
Oh, yeah.
you can't not eat for so long because it could trigger a migraine attack. Or, something with dehydration, if you weren't getting enough fluids the day before and then you have to wait so much long. So all these factors can play a role. And that's another type of anxiety that you can get because you're just like thinking, oh my gosh, I haven't eaten in so many hours and now I have to wait additional this many hours before I can even drink anything. And so those are things, again, that play a factor in that anxiety, that buildup to, again, getting these testing done that people really don't understand. Or maybe they do understand, but some people just have a harder time because, again, of their conditions.
Yeah, and I think what you're saying is so important. Like, it's okay if you're having a harder time, and it's okay to speak up and ask for options because in your case, there was another option, and now you know that for the future. So I'm really glad that you said, like, we need to stop, something's wrong.
I've never had that experience before. I've never done that before. And again, like you think that would factor into the approval, but it didn't. So again, I was on the phone several times and the fact that it took 3 weeks, 3 whole weeks, that's 3 weeks that I had to wait that much longer to get an answer, to move forward with what's the next step in my treatment? What are we going to do now? And that's something, as a person, not necessarily a patient, I felt was unjust. Like, I cannot believe that people have to go through this process. It just didn't seem fair. But at the same time, I learned that I do have a voice. And sometimes you do have to fight for what you need. And now I know that I'm not afraid to be on the phone. Not that I want to be, but it gave me more power over my situation.
Well, I think that's a beautiful note to end this spooky story on. Thank you for sharing with us and being vulnerable, sharing this hard moment, but also how you became an advocate and spoke up for yourself and others. So thanks, JP.
Yes, thank you, Zoe.
Well, thank you to JP, Shelley, and Sarah for those stories. They're spooky, scary, but also powerful in that we've learned from them. We've learned to advocate. We did advocate, and some of these folks did advocate in these stories. So there's the bright line. After October 31st comes November 1st. So
exactly. Yeah, it's important, I think, to share these stories because sometimes, like, when you're in these situations, you feel so alone. You're like, am I the problem? Like, what happened to Sarah? Am I the only one this stuff is happening to? But unfortunately, when you live with chronic illness and you're encountering providers often, like, this stuff does happen. And we're here to say, you have a voice and you deserve the care that's right for you. So we hope you have the tools through our 50 State Network to be able to speak up.
Definitely. It's sometimes about the confidence. And I just want to call out and thank all of our 50 State Network members for having the courage to speak up, for taking the time and energy to speak up on behalf of themselves and other patients. Because as you do that, you strengthen all patients around the country and around the world. And we hope that you learn something about advocating for yourself, even when things don't go as planned or they seem scary. Before we go, as always, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to this spooky edition of The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, hit that subscribe button, and email us in your spooky stories. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.